hopefully 6 days now. So as I was saying, I was in Havana, Cuba from the very first day the first cases of COVID were reported, and left Cuba on August 26th. Um, just to give a background of what Cuba's role has been in terms of healthcare, because I'm sure the audience is mixed. Some of us veterans to the to that reputation, and others who are not very very much aware yet. So the truth is that Cuba, since the onset of the revolution, rededicated its cause to uplifting the Cuban people by ensuring certain basic rights. Um, one of those key rights being the right to health. And it was paramount to its success. One thing that was paramount to its success was that Cuba had always paid attention to what um, uh, the decisions that had been made internationally. One of those key decisions or declarations being the Alma Ata Declaration of 1978, where it was established and underscored the importance of primary health care as a right to establishing health for all. So in 1978, by then, Cuba had already started training um, thousands of its young people to become medical doctors. And then had already established what would be one of the defining factors in its success as healthcare structure, which was the importance of the community polyclinic as the heart of that work that you do as a primary care specialist. And so later on in the 80s, aside from the polyclinic becoming important to this healthcare structure, the family physician and nurse were the key components that became those satellite entities that would contribute to the success of the community polyclinic. Why do I mention these things? Because without the family physician and the family nurse, the Cuban government could not keep a pulse on the state of health of their nation. These family nurses and physicians were responsible for assessing the state of health of their communities on an annual basis, getting to know their patients constantly in order to know what the prevalent problems were in or are in their communities, and then based on those problems, creating solutions along with the community, not just from a top-down fashion. These family physicians and nurses, the approach would be to sit down with these communities after highlighting the problems to assess how they could approach solutions together. Because we know one of the biggest issues is creating a solution or a treatment for a patient without keeping in mind what is within the possibilities of the patient makes it impossible for people to follow treatment plans or just their health. But more importantly, the approach or the focus of Cuba has always been preventative. And so these family doctors and nurses have been the pillars in keeping the population abreast and educated about their health and the problems that contribute to disease. So, um, needless to say, that has been the groundwork that has been in place in Cuba for many years now, and has led to what we know as um, the impressive positive health indicators that Cuba is known for. Its low infant mortality, which currently stands at 4 for every 1,000 live births, just uh, 99% vaccination for the entire population, um, and so many other things. And all this being under a criminal blockade. So, needless to say, Cuba has been in this game keeping health as an important aspect of keeping society healthy for a long time. And so when this pandemic hit, it was no different. In January of 2020, Cuba already had a prevention and control plan for the pandemic. And this plan outlined how all of the workforce would be educated, not only healthcare, but in other sectors, especially tourism, in order to educate the population. And also, this plan also outlined what would be done, how everybody would be mobilized in order to combat this pandemic. So when the first cases were called out on or confirmed in March 11th, on March 11th, when the first three cases were confirmed, Cuba went to work. That's just what happened. Um, the first thing was they enacted the National Active Pesquisa. This pesquisa is a community health survey that's usually done not just for COVID, but has been done periodically, annually, for other to combat other diseases such as dengue, which is endemic to Cuba. Um, and so we had experience with doing these community health surveys, and the video that we're going to show later is um, displaying how U.S. alum students were part of the student body. All medical students were called upon to go door to door and seek out patients that may have symptoms, find out who they had been in contact with in order to control this disease. So that was one thing. But what I wanted to share before you see that video, which will give you more detail about what exactly happened with the pesquisa, what I wanted to share was that Cuba's approach to this pandemic has been, for me, what I call the three T's: timely, transparent, and transformative. Timely because Cuba's response to the new coronavirus threat was quick. Like I said, they had a plan already in January 2020. And when the cases came on, they just took off. And I've explained the timeline for how the disease progressed. But after these cases started surging, we also saw that different other sectors were involved in um, creating solutions. But I'll get to that. The other T is transparent because the population was publicly informed on all measures being taken. The concerns of the public were publicly debated on national television and solutions proposed on those same platforms. The key here being that the Ministry of Health was entrusted to lead the fight and address the nation on the state of the situation. Daily reports were given by the National Director of Epidemiology, Dr. Francisco Duran Garcia, and he would give updated statistics on confirmed cases, deaths reported, and recovery, which statistically Cuba boasts 90% recovery rate for COVID cases. He would also talk about how many cases were stable, how many were critical, and who were in grave conditions. And all this information I'm saying was given in detail. And you can find this information on the Ministry of Health's website um, from day one until now, where they give you a clinical vignette of each case that is critical, which is something that's pretty much unheard of this side of the world. Um, but it's phenomenal to have witnessed that. Aside from that, he would aside from relating those hard facts, he would give general information about COVID-19 to the public, constantly um, educating and re-educating the masses about the nature of the virus and its signs and symptoms, as well as answering questions and concerns from the public. He would speak on the protocols being followed in Cuba and then drawing information received via teleconferences held with international counterparts. Cuba utilized its state-run media to really educate the public about what was going on with the battle against COVID. A key example was how they used the new show La Mesa Redonda, um, basically 2-hour daily conversations with national leaders and authorities, uh, giving us detailed answers to people's concerns and questions. And on several occasions, the president, Miguel Diaz Canel, was present to have frank discussions with the general population. I saw uh, the director of the Institute of Tropical Disease, Dr. Lupe Guzman, come on and teach the public about what COVID was all about, the history of viruses in general, and then more particularly how this virus differed from other viruses like H1N1 and the old SARS virus, which was identified in 2003. These are things that we, I, we, I don't know how to express to you, but for me, seeing that on a public um, level was super impressive. And later on, we would down the line would see the leadership team behind the search for the COVID vaccine at the Finlay Institute also come onto TV and teach the masses about what the whole process of finding and identifying a vaccine looks like and how much time it takes and the elements that would be incorporated in that specific Cuban vaccine. So they didn't leave anything in anybody in the dark about this situation or the fight and how everybody was involved in working 24/7 to ensure that Cuban people were safe. And not only Cuban people, the rest of the world, because Cuba never leaves its neighbors behind. That's just how it is. Um, and so I just want to express that you see here that there was an active campaign to maintain health literacy as a pillar in preventative healthcare, which is something, unfortunately, we do not understand yet in many parts of the world. Then the last T was it was transformative because it showed the coverage of the convergence of disaster preparedness and health prevention measures, which Cuba is known for, um, and Cuba using its intersectorial approach. Um, this public health problem became not just contingent upon what the Ministry of Health would say or do, but rather what all sectors of society would contribute. So you had agriculture come in, you had commerce come in, you had travel and transportation, all involved, put together. Everybody's activity was all reorganized in order to keep the population safe. Um, and I could go on, but I want you to see some of the things that happen on the ground um, by the students, the medical students, in this case, the US medical students, when we were there. So thank you.